Thank you all for coming today. It really does mean a great deal to all of us in the department to have you here to help celebrate our 50 years as a department in the Bloomberg School of Public Health. And we have focused during that time on global priority issues, global health issues. I'm Bob Black. I'm chair of the department, for those who I haven't met. This is a gathering of faculty and staff and students from the department, as well as alumni. It also is a gathering of friends of the university, colleagues also from the Gates Foundation, and other supporters of the university and our department. In particular, I'd like to welcome Hopkins University President Ron Daniels, our Dean, Michael Klag, and of course, our special guest for this event, Ms. Melinda Gates. We're truly honored to have you all here today. We have a full program for you, and a program that fits in just 30 minutes. It's not easy for scientists and public health practitioners who care very passionately about what they do or what we do to fit all of this into 30 minutes, but I think we've done it. We may move quickly, but I hope we'll have time during this to let you reflect a little bit and have some moments also that you will remember for a long time. So I'd like to get started. I have the pleasure of introducing President Ron Daniels, who has led the Hopkins community for the past 2.5 years. He has placed a great commitment to the role of interdisciplinary research and collaboration to solve very important national and international problems. Ron?
Thanks, Bob. I think that's all he allowed me for getting through this program. But if I could just take a few more minutes, I'll talk quickly so that we get that very ambitious agenda. I was even struck there's moments of reflection that you have built into the 30 minutes. They said you were good. I'm delighted to be here with you, Bob, with Dean Klag, our faculty, several of our trustees, distinguished friends, students, and of course, Melinda Gates to mark a historic moment in international health. I also want to pay a special note of welcome to Bill Richardson, one of my predecessors, and his wife Nancy, who are here with us today. I know you are pressed in a number of different directions, only come back to your university, our university on special occasions, and we're just thrilled that you're here with us today. As we gather to celebrate 5 decades of this department's transformative contributions to global health, I'd like to give just a bit of present-day context. 50 years ago, I assume that even the visionary founders of this department could not have imagined that public health would be one of the most popular, if indeed not the most popular, undergraduate major at Johns Hopkins. It is a major that continues indeed to grow explosively. In 2003, we had 171 undergraduates majoring in public health, and this fall we have 362, with a quarter of our seniors actually focused on global health issues. 50 years ago, we could not have envisioned launching a group of undergraduates into a 6-week rotation in South Africa. But a few weeks ago, our inaugural cohort returned from a program that included studies at the University of Cape Town and placements with NGOs working on issues such as tuberculosis and drug rehabilitation. These students were part of the 85 global health grants we created last year for students from across the university in response to their demand to be able to apply the knowledge, the insights gleaned here in Baltimore to the monumental challenges confronting the developing world. 50 years ago, we could not have dreamed of the successes that our divisions within the school and indeed across the university would enjoy when working together on pressing global health challenges like securing safe drinking water supplies or reducing HIV transmission. Today, as an example, at the Johns Hopkins Malaria Research Institute, located here, we have computer scientists, molecular biochemists, pediatricians, and others combining their efforts to advance our understanding of a disease that afflicts some 250 million people a year. Now, from my vantage point, these interdisciplinary approaches to medical and health research constitute the best shot at developing breakthroughs to the wrenching consequences that afflict many citizens throughout the world and give us the best shot of alleviating and ideally avoiding many of these consequences. This is one university at its best. But within this mounting interest and commitment to global health across the university, the Department of International Health remains the touchstone, the standard bearer, the exemplar of our commitment to this field. And I told you, Bob, that I would not hold back. So this is very genuine and heartfelt. You need the core. At the heart of this place, the first such university department of its kind is a scrappy, determined commitment to the life-changing power of ideas and innovation, and really very much embodied in your leadership of this great department, Bob. Research from this department has helped improve vaccines, control infectious diseases, prevent malnutrition, reduce road traffic accidents, and most importantly, save millions of lives. Today, we celebrate this belief in the possibilities of ideas and innovation, not only by marking this milestone anniversary, but by honoring fellow innovators. And in this vein, I am truly delighted to be able to welcome Melinda Gates to Johns Hopkins University and to celebrate the commitment that she and her husband have made to the global health agenda. Melinda, there is no question but for your combined foresight, your humanity, your generosity, your commitment, and of course your leadership, our world, particularly its most challenged places, would be a very different, much less decent planet. We have a lot to celebrate today. A half-century of innovative contributions to global health, the pioneering leadership of Bill and Melinda Gates, and a future in which we will continue to harness the strengths of our globally minded university to address the needs of our global community. And now, 25 minutes to go. Thank you.
Thank you very much, Ron. Now we're going to have a video to give you a few highlights of our department contributions over the last 50 years, but also the continuing contributions to save lives around the world. So if we could roll the video.
When determined minds and compassionate hearts work together to solve the most critical health issues of the day, something amazing happens. Inspiration meets innovation. Research creates results. For 50 years, the Johns Hopkins Department of International Health has created real-world public health solutions, giving children everywhere a healthy start and hope for the future.
The Department of International Health is an exciting place to work. We have very experienced and multidisciplinary faculty, and we have talented students from all over the world.
Johns Hopkins Department of International Health is the oldest and largest program of its kind in the world. Created in 1961, it took shape in the shadow of the Cold War. Reaching out to poor and developing countries was a powerful new diplomatic tool to foster global relations. Carl Taylor was the department's first chair.
Carl was a public health visionary, a true giant in the field, and he set the mission for our department. The mission has been to save the lives and improve health of the people around the world, particularly the poor and the most vulnerable.
The department's efforts forged a global health agenda with groundbreaking discoveries that drove the child survival revolution of the 1980s. millions of children were dying from diarrhea, pneumonia, and other illnesses.
Early in my career in India, every single day I saw children dying from diarrhea. We were not able to save those babies because we didn't have enough IV fluids and enough doctors or nurses. But oral rehydration therapy changed everything. At the cost of a few pennies a packet, these children are now surviving.
The department pioneered life-saving vaccines to combat pneumonia, diarrhea, and meningitis. Today, every child in the United States is protected against these dangerous diseases.
We are working towards ensuring that every child in the world has access to these vaccines. For example, the hip vaccine is now available to over 90% of the poorest children in the world.
By the late 1990s, the number of childhood deaths had dropped dramatically. But the number of newborn deaths remained disturbingly high.
4 million children still died in the first weeks of life, and we needed to do something more to address these problems.
The department's researchers went to work. They poured their energy into solutions to address complications in pregnancy, difficulties in childbirth, especially home deliveries, and infections and illnesses that threaten infants.
One of the major impacts that Johns Hopkins has had on the world's children is asking and answering important questions about what can be done and be done in very low resource settings to save lives. And probably the best example of that is the work that we've done together on community-based newborn health in places such as Bangladesh.
In Bangladesh, we conducted studies to demonstrate that health workers can help mothers to deliver babies safely and ensure their survival. In Nepal, our research has showed that using something as simple as antiseptic wipes can prevent dangerous infections.
Through these interventions, mortality has been reduced by 30 to even 50% in this first month of life.
The department also put malnutrition on the global health agenda. Field studies are shaping a simple yet profound solution, using specially trained local health workers to deliver nutritional information and supplements.
The results of our research have been astonishing. Vitamin A, for example, reduces infant, child, and even maternal mortality. Giving zinc to children dramatically reduces the health consequences of diarrhea. Giving women iron during pregnancy not only reduces risk of anemia, but improves cognition of their children. We are finding new problems and looking for new solutions all the time. It's part of our job.
At the department's heart lies an outstanding team of faculty and students who are determined to solve the critical issues of the day.
One of our major focuses right now is strengthening health systems in poor and war-torn countries. We're working in particular in Afghanistan, Bangladesh, China, India, and Uganda, and several neighboring countries in East Africa.
I'm getting my PhD in health systems, and I chose Hopkins because it's truly a global school.
There's nothing that is more attractive to young people than actually seeing the application of many things they learn in the classroom and seeing the improvement in people's health locally. And the department has been a champion in that regard.
To uncover solutions that work for real people on the ground, we have to go beyond just a simple biomedical approach. We have to work with communities to make sure that they're able to find the solutions that work for them. And that's what I'm learning to do here at Johns Hopkins.
Our students are our future. Students come from many countries in the world, and they will go back to their countries and to international organizations and be the global leaders of the future.
While the challenges may change, the mission remains the same: to improve health around the world and save lives.
Our department has accomplished much and contributed much in the last 50 years. But 8 million children still die each year. Millions are afflicted by AIDS, tuberculosis, malnutrition, and many other conditions. There are new challenges ahead, and we are ready to meet those challenges.
So I hope that does give you some sense of the scope of what we've accomplished in the last 50 years. I must say, we're not quite as telegenic as Dr. Richard Besser, who's with us today, ABC TV's chief health and medical editor, and we thank him for the narration of the video. But we do want to be good storytellers. We do want to tell the world what has been accomplished and what challenges remain. We do have one illustrative story to tell, and this will be done by one of our colleagues, a giant in the field of global health and a pillar of the department, my good friend Madhu Santosham.
Thank you. Thank you, Bob. It's a true privilege for me to be here in the presence of co-chair Melinda Gates, President Daniels, Dean Klag, and all of these distinguished guests and colleagues. I will start by embarrassing Bob, because Bob doesn't talk about himself. He's been a true leader for our department. You've inspired all of us, Bob, and you've been a true visionary for public health. Thank you for all that you've done. Thank you. Just to give you an example of Bob's vision, in the late 1990s, many of us in this room were working on preventing childhood deaths. Bob was one of the first people to point out that although the deaths among children between 1 month and 5 years of age is coming down, the deaths among children or babies between 0 and 1 month, what we call newborn babies, remained stagnant for almost 20 years. And Bob took the initiative in 1999, and Gary will remember this, to hold the first international conference on neonatal health here at Johns Hopkins. That conference brought together public health leaders, international organizations, and donors from all over the world. It galvanized the international community to tackle this enormous problem. Not only that, the Bill and Melinda Gates Foundation very soon made a major investment in neonatal health. Soon, other donors followed. And 6 years later, this department started the first international center for advancing newborn health. And I'm delighted to tell you, the founder and the first director of that center is here today with us, Gary Darmstadt. Gary, would you mind standing up for a minute? I don't want to embarrass Gary too much, but I met Gary as an intern in the Department of Pediatrics 25 years, almost 25 years ago. And I had the opportunity and the pleasure and honor to mentor him and become his friend. And Gary has contributed enormously to neonatal health. I'm very proud of you, Gary, and thanks for all that you've done. But my friends, there's been a lot that's been done in the last 10 years. We've come a long way, but there's a long way to go. Every single year, 3.7 million newborns die. By newborns, I mean babies between 1 and 30 days of age. That translates to 10,000 deaths each day. Between now and tomorrow, at the same time, another 10,000 babies will die. We have to stop this, and we have to act now. And I'm really glad that many of you in this room have made the commitment to do this. And many of you may not realize the life of a newborn baby is intimately related to the mother's survival. If a mother dies during childbirth, the chances of that child dying goes up sixfold. So this doubly underscores the importance of making sure that both the mother and the baby survive during childbirth. Unfortunately, today in Africa, if a mother gives birth to a child, her chances of dying is 100 times as high as a mother who's giving childbirth here. This is a true tragedy. Unfortunately, the global health community has not paid enough attention to this particular problem. But not everyone has neglected this problem. Melinda Gates, who's with us today, has been a champion for maternal health. In particular, she's been a champion for safe childbirth. Thanks to you, Melinda, many mothers and poor children around the world have a chance to live today. We're all grateful to you. Thank you very much. Today, in recognition of the importance of protecting both the baby and the mother, we in the Department of International Health are renaming our Center for Newborn Health as the International Center for Maternal and Newborn Health. This center will bring together the enormous expertise of our faculty across this university, and we will partner with major institutions around the world to comprehensively come up with strategies to tackle this dual problem of maternal health and newborn health. We will do everything possible to ensure that every mother and every baby survives. We also want to make sure that every child, every baby, and every mother has the best chance of attaining the best quality of life. I think we owe it to them. I know we can do this if we all work together, and we will do this. I want to end with a quote from the Chilean Nobel laureate Gabriel Mistral. "We are guilty of many errors and many faults, but our worst crime is abandoning the children, neglecting the fountain of life. Many of the things we need can wait. Children cannot. Right now is the time their bones are being formed, the blood is being made, and their senses are being developed. To them, we cannot answer tomorrow. We must answer today." Thank you so much for your commitment to public health.
And thank you, Matu, for your explanation of the relaunching of our center and for your leadership in global health. So now I'd like to turn to a very important moment in our event, and this is also about leadership. In the department, thinking about our 50th anniversary, we thought, well, there was a need to draw attention and honor those who have been champions of research and development, particularly addressing global health issues. Without this research and development, yesterday we would not have the life-saving technologies we use today. And without more investment today, we will not have breakthroughs that we need for tomorrow to further address these problems. So we need champions of research and development for global health, and we all need to honor them. So today, the department announces the creation of the Global Health Leadership Award, and the inaugural winner of that award is Bill and Melinda Gates. Today, we're honored to have Melinda Gates with us, and before I welcome her up to the podium, I would just say a few things about Bill and Melinda Gates. Both have galvanized world attention to the great untapped potential of new technologies and simple, inexpensive solutions to diseases and conditions that plague millions of people around the world. The foundation has poured billions of dollars into research for global health, and when we open the curtain behind the many discoveries and announcements that are coming every day, we often hear the names Bill and Melinda Gates because of their funding and their leadership. Their impact is immense. Here's what Bill Gates said in his annual letter that was published earlier this year about why he and Melinda have decided to devote so much of their time, energy, and funding to these issues, and I quote, "If societies can't provide for people's basic health, if they can't feed and educate people, then their populations and problems will grow, and the world will be a less stable place. Whether you believe it a moral imperative or in the rich world's enlightened self-interest, securing the conditions that will lead to healthy, prosperous future for everyone is a goal I believe we all share." Certainly I, and I'm sure I speak for many others in this room, believe it is a moral imperative that we seek solutions to provide for people's basic health. Let me say one more thing about Bill and Melinda. Their impact isn't limited to their own funding through their foundation. They have inspired many others to get involved, to care, and to give of their own time and funds. In the past year, they have, along with Warren Buffett, approached generous individuals in our country and abroad about the Giving Pledge. It is simply a commitment to give half or more of your wealth during your life or at the time of your death. Dozens, I think scores would probably be the correct term now, have signed up for this Giving Pledge. This has unlocked enormous resources for decades and actually generations to come, and have inspired all of us. So we are very pleased to give you this award and ask you to come up to receive it.
Thank you so much. I can't tell you what an honor it is to be here to receive the first inaugural award. And as we all know, that it really takes leadership, and really Bob Black's leadership of the department for the last 30 years has really been tremendous. And Bill and I have gotten to know him over the last 10 years and have amazing respect for what goes on here at Hopkins. One of the things that I believe is that you should always learn from your elders. And my father-in-law, Bill Gates Sr., who is about to turn 86 this fall, is one of the people that I learned from. Two important things that I've learned from Bill Gates Sr., which is, one is that if you receive a beautiful award like this, you should not put it up here on the podium. Because my husband and I were sitting in the front row, and Bill Gates received an award on behalf of the foundation. He put it here on the podium. It was a brand new award, and it crashed to the floor and shattered everywhere. So I learned from him that we should leave the award here. And the second thing I learned from him is he has been in this building far more than I have, and he's been saying to me for a very long time, "You've got to go see Hopkins." And I follow Hopkins research quite vigorously, and I see the work in the field all the time, and it's really quite remarkable work, as you saw in the video. You know, when Bill and I started in this field of global health, we really started together. In fact, we got to know each other in the software industry. I was working at Microsoft. I worked there for 9 years, really enjoyed it. And when Bill and I got married, he kept saying, "I'm going to do the foundation one day, but it's going to be when I'm in my 60s. And slowly but surely, as we learned about family planning from some of the great researchers here at Hopkins, and as we learned about the difference that vaccinations could make in the developing world, and how small investments could really change a family's life and change economic development in the developing world, we got going on our foundation much more quickly. So if Bill were here today, he would be thrilled to be up here as well, my Bill with me. He couldn't be here today because this weekend he's on his way to Nigeria and Chad on behalf of polio. So we travel often and extensively these days on behalf of global health. As you heard earlier, the groundbreaking work that was done here by Carl Taylor, that village healthcare worker, we know that is what's making a difference now in countries like Ethiopia, Malawi, India. When you're starting to see those health statistics get better, vaccinations rates go up, women being able to access health services, it's because of that initial seminal idea that he proved out. Oral rehydration, one of the first things I saw when we got into global health work out in Bangladesh, was pioneered here at Hopkins, and millions, literally tens of millions of children's lives have been saved because of ORS. The Hib vaccine, we've known for a long time that diarrheal and pneumonial diseases are what kill these young children, and we needed those breakthroughs on the Hib vaccine. Those were pioneered here with Hopkins and many other partners, and really the policy changes that were needed to get that vaccine out in the world. And now we're seeing it being adopted wide scale around the world in the developing world. And it's, again, literally going to save millions of children's lives. So it's that cutting edge research that we see time and time again that can only come from an institution like this. Now, I feel a little bad about some of the great researchers we've actually taken from Hopkins, like Gary Darmstadt, except that you have a faculty now that's 140 strong. And so it's amazing to see the graduates that are coming from a place like this. As Bill and I travel around and speak on behalf of these global health issues, one of the things that we try to get people to realize is that we have to be both impatient. We've got to get these innovative tools, these vaccines, these reproductive health, modern contraception out to families. So we've got to be impatient about the work, but we've also got to be optimistic. I think so often in the past, we talked about when we would see what was happening in the Horn of Africa and other places, we talk about the devastation of poverty and the suffering and the human misery that was connected with it. And believe me, when I go to the developing world, I see it and I feel it, and it's painful. But at the same time, there is huge optimism because of the innovation that's happening. Getting tools out in the developing world is literally changing people's lives. One of the statistics that Bill and I love, it's our favorite one, is back around the time I was born, back in 1960, 20 million children used to die under the age of 5. 20 million children every single year. Now, as of 2010, that number is well under 8 million children dying a year. That is a huge drop in the death rate of children. Now, 8 million is still way too many. In fact, the number is somewhere between 7.3 and 7.6 million, depending on whose statistics you believe in. But that's still too many. And the thing that I think we really came to realize as a global health field in the last many years was that we had to take that number apart and look at it and say, well, it's not enough to save the children who are 30 days to 5 years old with vaccines and other things we were delivering. We really needed to look at that first 30 days of life and say, what is it that's killing 4 million children still of that 8 million? And we finally are tackling that piece of the problem. So to tell you a little bit about what I see, I was in one of the most poor places in India about 18 months ago to see a cutting-edge research site run by Vishwajit, a researcher here from Hopkins, out in the most rural northern part of India. He's got his research totally embedded in the community, and what he's proving out is that cutting-edge social behavior change makes a difference. And by that I mean that if you teach a woman not about tools or expensive things, but about breastfeeding her baby, immediate and exclusive breastfeeding, keeping her baby warm, not washing the baby right away with a gritty, sandy paste or setting it aside, but keeping that baby warm and wrapped up, just with her own sari, makes an enormous difference. He's proving this out in this village, and in fact, during the time this research site has been up and running, if you ask the villagers what they've seen, and you say, if you ask all the women in the village, we got them all to sit around in a huge group like this, and you said, how many of you have lost a children? An enormous number of hands went up. Almost all the hands in the village went up. And when I said to them, how many of you lost a baby in the last 18 months? So many of the hands went down. And in fact, what Vishwajit's been able to prove in this remote village is that he can get a decline in the depth rate in those brand new neonates by over 54% just by teaching women behavior change. That's what I call cutting edge research. And that's the kind of research that Hopkins pioneers over and over and over again. And so it's the partnership. It's the partnership of what Hopkins does with philanthropies, with other NGOs, with governments, both rural and governments that come out of the developing world, to take this cutting-edge research and then disseminate it and make it standard practice in the developing world. That, to me, is the legacy of this department of the last 50 years. That's what you've done, and I can't imagine, looking forward, how more excited I could be to see what comes next. So thanks for honoring us with this award.
Melinda, it is we who are honored that you and your husband have accepted this award, and we believe it will be an inspiration for future recipients that you have. Thank you. And now to close our event, I'd like to introduce the Dean of our school, Michael Klag.
Thanks, Bob. And Melinda, thank you for those inspirational words. I think I speak for everybody in the room when we say that your work, your husband's work, and the work of the foundation really inspires all of us. You know, our motto is up there, it's protecting health, saving lives, millions at a time. And that motto derives from the belief that you have in your foundation that every life has value. We believe that. It's what motivates our work. I am happy, however, that you brought up the poaching issue. Because we had a meeting earlier, and I think of the 5 people from Gates in that room, 3 had been in Hopkins. Not only Gary, but also Jose Ramon, Oying, and Monica was here as well. So if you could cool it on that side, we would appreciate it. But as you said, it's a great department. It's a great department because it has great leadership, but also because we recruit great students who then become our faculty or go out in the world, and we have great faculty, and that's who's in the room today. And I want to congratulate you as well, because you're the ones who have made this such a great department. So we have time to celebrate now. I invite everybody down to the atrium downstairs, and we'll have a reception and a chance to talk. So thank you all.